Welcome to St. Cloud State University. This presentation will provide an overview of benefits information, including retirement benefits. Please write down any questions you may have during this presentation to ask your HR representative after the video has finished. The state of Minnesota offers medical and dental coverage. The state offers the ability to purchase disability insurance. If you are in a managerial or administrative position, you will be eligible to participate in the manager's income protection plan. Basic term life insurance is provided to you at no cost. Term life insurance covers you only for a specific term, which in this case, is the duration of your employment with the state of Minnesota. The amount of your basic term life insurance depends on your contract and salary, but the maximum amount of coverage is $95,000. If you have questions about the specific amount of coverage you will have for basic term life insurance, please ask your HR representative. You can also choose to purchase additional life insurance for yourself, your spouse, or your children under the age of 26. If you purchase life insurance for your child or children, one monthly premium provides coverage of $10,000 for each child. The cost for child life insurance is the same regardless of whether you have one child or any number of children. There is just one monthly premium cost that provides coverage of $10,000 for all children under the age of 26. Accidental death and dismemberment insurance is already provided in your basic life insurance. You can choose to purchase additional accidental death and dismemberment insurance coverage for yourself or a spouse. You can also choose to participate in pre-tax benefits, in which you can elect to have money taken out of your pay before taxes, and use that money for eligible expenses. Such expenses can account for out-of-pocket medical and dental payments, dependent daycare costs, and transit expenses if you use public transit to get to work. There are well-being benefits, including our Employee Assistance Program. As a benefits-eligible employee, you will earn leave. The amount and types of leave that you earn depends on your contract and employment type. For example, IFO faculty members will not earn vacation leave due to the academic year having breaks. However, IFO faculty members have personal leave days that can be used in lieu of vacation. Some employees have sick leave credited to them at the beginning of their employment. Leave crediting and accruals are all governed by the contracts or the labor plans that an employee is covered by. Please ask your HR representative for more information about your leave accrual levels. State health insurance requires you to choose a primary care or home clinic. This is where your primary care provider is based. The primary care clinic cost level will determine the cost of your annual deductible, your copays, and your maximum out-of-pocket expenses. Your monthly premiums for health insurance will be the same regardless of the cost level of clinic you choose. However, your deductible, copay, and maximum out-of-pocket expenses will be based on your cost level of primary care clinic. At the top of the schedule of benefits, there is the URL, and in the PDF version of this packet, a link to the clinic lookup tool. If you go to this website, you can search clinics to see which clinics are in which cost level. The clinic lookup tool will allow you to see clinics and their cost levels listed according to insurance carrier. You can search clinics by county location, city, clinic name, or cost level. A clinic's cost level can change depending on the insurance carrier you select. There are three options for health insurance carriers: Health Partners, Blue Cross/Blue Shield, and Preferred One. All three carriers offer the same plan and coverage, as well as the same cost for monthly premiums. However, individual primary care clinics in combination with different insurance carriers can make a primary care clinic a higher cost level clinic. Let's look at the Alena Health Clinic in St. Michael, a city south of St. Cloud. Blue Cross Blue Shield Insurance makes this a cost level 2 clinic, which is the second lowest cost level. Health Partners and Preferred One makes this a cost level 3 clinic, which is the second highest cost level. So, if you wanted to make this your primary care clinic and wanted to watch your health insurance costs, you would likely want to choose Blue Cross Blue Shield. This will ensure that you are at a cost level 2 for this home clinic. As you can see, all 4 cost levels cover preventive care services at no cost to you. These services include routine annual physicals, annual eye and hearing exams, and immunizations. For any services beyond preventive care services, you would first pay your annual first dollar deductible, which is dependent on the cost level of your primary care client and your type of insurance coverage. For a cost level 1 clinic, your annual deductible for single or employee only coverage would be $250, and your annual deductible for family coverage would be $500. If you have a cost level 2 clinic, your single coverage deductible would be $400, and your family coverage deductible would be $800. For a cost level 3 clinic, your single coverage deductible would be $750, and your family coverage deductible would be $1,500. For a cost level 4 clinic, your single coverage deductible would be $1,500, and your family coverage deductible would be $3,000. Once you've paid your deductible, you would begin paying a copay for each office visit or other service. Your copay amounts depend on your primary care clinic cost level and the type of service you are receiving. Office or urgent care visits have a $35 copay if you have a cost level 1 primary care clinic, a $40 copay if you have a cost level 2 clinic, a $70 copay if you have a cost level 3 clinic, and a $90 copay if you have a cost level 4 clinic. In-network convenience clinics, such as CVS Minute clinics, are a cost-effective way to receive care from a doctor or nurse practitioner for non-urgent illnesses and minor injuries. Other in-network convenience clinics are also available. Once you receive your insurance card, you can call your insurance carrier using the number on the card to find out the coverage of in-network convenience clinics in your area. Online care is also an option for less urgent illnesses or injuries. Online care allows you to have a virtual visit with a physician or nurse practitioner. Blue Cross or Health Partners allows you to have access to Doctor on Demand or Virtuel. If you are a member of Preferred One, you only have access to Virtuel or MD Live. Since in-network convenience clinics and online care are cost-effective methods of delivering healthcare, they are provided at no cost to you and are free to visit. There is no copay or charges toward your deductible for in-network convenience clinics and online care visits. Please note that telemedicine visits are not free. These are charged the same as an in-person visit to a clinic. Only online care through the Virtuel, Doctor on Demand, or MD Live apps are covered at no cost to you. An emergency room visit has a $100 copay for cost levels 1, 2, and 3. The cost level 4 copay is 25% of the bill. Hospital-provided services include emergency room care, inpatient hospital care, outpatient surgery at a hospital, or any other hospital outpatient services. Please note that the copay for any hospital-provided services is set by the cost level of your primary care clinic. This is because hospitals have no cost level under the state health insurance plan. Therefore, if you have a cost level 1 primary care clinic, you will pay the cost level 1 copays for any hospital-provided services. For an inpatient hospital stay, including inpatient surgery that results in an inpatient hospital stay, you would pay a $100 copay at cost level 1, a $200 copay at cost level 2, a $500 copay at cost level 3, and a copay equaling 25% of the bill at cost level 4. Again, these cost levels are dependent only on the cost of your primary care clinic, and not on the hospital itself. If you were to be admitted to the hospital as an inpatient directly from the ER, you would only be charged the inpatient hospital copay, and you would not be charged the emergency room copay. For outpatient surgery, you would pay a $60 copay at cost level 1, a $120 copay at cost level 2, a $250 copay at cost level 3, and 25% of the bill at cost level 4. There is no copay or deductible charge for hospice or skilled nursing facility care. Prosthetics and durable medical equipment have a copay totaling 20% of the bill at cost levels 1, 2, and 3, and a copay totaling 25% of the bill at cost level 4. Lab and basic X-ray services have a 10% copay at cost levels 1 and 2, a 20% copay at cost level 3, and a 25% copay at cost level 4. MRI and CAT scans have a copay of 10% at cost level 1, 15% at cost level 2, 25% at cost level 3, and 30% at cost level 4. Any services not covered above in the schedule of benefits have a copay of %5 at cost level 1 and 2, 20% at cost level 3, and 25% at cost level 4. This would include services like ambulance services and non-surgical outpatient treatment at a hospital. Prescription drugs are also covered under the health insurance plan. Prescription drug coverage is the same no matter what cost level of primary care clinic you have. For prescription drugs, you would pay a copay based on the tier level or expense of the drug. For the cheapest drugs, you would pay an $18 copay. Mid-tier drugs have a $30 copay. And the most expensive drugs have a $55 copay. CVS Caremark is the administrator for our prescription drug plan. You will receive a separate prescription insurance card. There is a maximum amount you would have to pay for prescription drug expenses within a calendar year. This amount is dependent on whether you have employee-only coverage or family coverage. For employee-only coverage, the maximum out-of-pocket amount for prescription drugs is $1,050. For family coverage, the maximum out-of-pocket amount for prescription drugs is $2,100. Also, there is a maximum amount you would have to pay for medical expenses other than prescription drugs within a calendar year. This is called the maximum out-of-pocket expense. Your annual first dollar deductible amount counts toward the maximum out-of-pocket expense. Once you have reached your maximum out-of-pocket medical expense for a calendar year, your insurance will pay all remaining medical costs for eligible services for the rest of the year. Remember, the prescription drug maximum out-of-pocket expense amount and the medical expense maximum out-of-pocket expense amount are separate. The maximum out-of-pocket expense for medical costs other than prescription drugs varies based on whether you have employee-only or family coverage, and also based on the cost level of your primary care clinic. For cost level 1 and cost level 2, the maximum out-of-pocket expense amount for the calendar year is $1,700 for employee-only coverage and $3,400 for family coverage. At cost level 3, the maximum out-of-pocket expense amount is $2,400 for employee-only coverage and $4,800 for family coverage. At cost level 4, the maximum out-of-pocket expense amount is $3,600 for employee-only coverage and $7,200 for family coverage. All of these costs assume that you and your covered dependents live within Minnesota and access clinics within the state. For additional information about coverage, if you or your covered dependents live outside of Minnesota, see the Point of Service Coverage section of the Employee Benefits Handbook, which is part of this packet. There is a monthly premium for health insurance. This premium depends on whether you have employee-only coverage or family coverage. As you can see from the premium rate list, the amount of the monthly premium is the same no matter which of the three insurance carriers you choose. As an employee of the Minnesota State Colleges and Universities, you have only two options: employee-only coverage or family coverage. Employee-only coverage covers only you, and family coverage covers you, a spouse, and any children or stepchildren under the age of 26. There are additional eligibility requirements for spouses. For more information, see the Dependent Eligibility section of the Employee Benefits Handbook, which is part of this packet. The monthly premium cost also depends on whether you are full-time or part-time. Full-time employees receive the 100% employer contribution, the amount of the cost of insurance that the state pays, and therefore pay the lowest monthly premium amounts. Part-time employees receive a 75% or lower employer contribution, and therefore pay a higher portion of the cost of the insurance, as the state pays a lower amount of the total monthly cost of insurance. Most part-time employees of SCSU who are benefits eligible receive the 75% employer contribution and pay the 75% employer contribution rates. If you are not a full-time employee and are unsure if you will receive the 75% employer contribution or a lower contribution, ask your HR representative to tell you what your monthly premium rates will be at your employer contribution level. Monthly premiums are deducted before tax from your paychecks, and are always deducted in 2 equal amounts per month on paydays. For months with 3 paydays, deductions are only taken out from the first 2 paychecks of the month. At the 100% employer contribution, the state pays $696.30 of the monthly insurance cost for employee-only coverage, and the employee pays a monthly premium of $36.64. For family coverage, the state pays $1,905.38 of the monthly insurance cost, and the employee pays a monthly premium of $250. At the 75% employer contribution, the state pays $522.22 of the monthly insurance cost for employee-only coverage, and the employee pays a monthly premium of $210.72. For family coverage, the state pays $1,429.04 of the monthly insurance cost, and the employee pays a monthly premium of $726.34. There are 2 dental insurance carriers available, Delta Dental and Health Partners Dental. Both insurance carriers provide the same coverage and are the same cost. The only real difference between the insurance carriers is that some dentists accept only one insurance or the other. At the top of the dental benefits schedule page are the URL. In the PDF version of this packet, there is a link to the dental search tools from each plan. You can use these tools to find a dentist that is in network for each plan. If you have a dentist in mind that you want to see, you can simply contact the dentist and see which insurance they accept. Diagnostic and preventive care services, which include up to 2 routine dental exams per calendar year, x-rays, sealants, and any other services listed in this section, are provided without a copay. They do not require the payment of a deductible. There is no cost to you for these diagnostic and preventive care services. If you receive services listed under the restorative care and prosthetics area, these services are covered at 80%. A deductible and the plan maximum annual benefit per person would as well apply. For this year, the maximum per person benefit is $2,000 after the deductible is met. There is a lifetime maximum of $3,000 per person for orthodontics. This means that if you have braces or other orthodontics, the plan will cover up to $3,000 in cost for your lifetime for those orthodontics. Any costs above that amount for orthodontics for that person's lifetime would be the patient's responsibility. If, for example, you were to need crowns, you would pay your deductible, and the plan would then pay 80% of the bill, up to the maximum per person benefit of $2,000 per person for restorative care and prosthetics. You would then be responsible for the remaining 20% of the bill. Once the plan has paid out the maximum per person benefit of $2,000 for a specific person covered under the plan for the calendar year, any other restorative care and prosthetic services for that year for that specific person would not be covered. At the 100% employer contribution, the state pays $27.24 of the monthly insurance cost for employee-only coverage, and the employee pays a monthly premium of $13.50. For family coverage, the state pays $67.14 of the monthly insurance cost for employee-only coverage, and the employee pays a monthly premium of $53.40. At the 75% employer contribution, the state pays $20.44 of the monthly insurance cost for employee-only coverage, and the employee pays a monthly premium of $20.30. For family coverage, the state pays $50.38 of the monthly insurance cost for employee-only coverage, and the employee pays a monthly premium of $70.16. If you purchase additional life insurance as a new employee within your first 35 days, you will have guaranteed coverage for up to certain amounts, twice your annual salary for you, and up to $10,000 for your spouse, if applicable. If you choose to purchase additional life insurance beyond these amounts, you will need to provide evidence of insurability, which would involve a health screening questionnaire and possibly a physical from a doctor before you could be insured for the additional amounts. The rates for additional life insurance vary depending on the age of the person you are adding coverage for, and the amount of additional coverage. For example, let's say that you are in the 35 to 39 age bracket. At that age bracket, additional life insurance costs 23 cents per paycheck per $5,000 of extra coverage. So, at that age range, an additional $10,000 of life insurance coverage beyond your basic term life insurance provided by the state would cost you 92 cents per month. You would find the cost for insuring a spouse by finding their age bracket and determining the additional amount of coverage you want to add. If you want to add child life insurance, a monthly premium of 84 cents provides $10,000 of coverage for each child for all your children under age 26. The single monthly premium of 84 cents stays the same no matter how many children you have. Accidental death and dismemberment insurance is a flat rate of 8 cents per paycheck per $5,000 of coverage, no matter what the age of the persons you are covering is. You can purchase accidental death and dismemberment insurance for yourself or a spouse. Short-term disability is an optional insurance that protects a portion of your income if you were to become disabled and unable to work for a time period. Please make sure to review the important information on the first few pages of the short-term disability brochure included in this packet. This covers information like exclusion and waiting periods, eligibility, and maximum coverages. To determine the maximum amount of short-term disability coverage you are eligible for, review the monthly income rates on this page of the packet. Short-term disability maximum coverage amounts depend on the amount of income you earn before tax on a monthly basis. You can protect up to 2/3 of your monthly gross income. For example, let's say you earn $3,000 a month before taxes. The maximum amount of income you could protect per month would be $2,000. That amount of coverage would cost you $17 per paycheck, or $34 per month. If you earn $3,000 a month, $2,000 would be the maximum amount you could protect. However, you could choose to protect less than $2,000 a month if you wanted, at a lower cost. For example, if you decided that you could cut some expenses and get by on only $1,500 a month if you were to become disabled, you could protect that amount of monthly income for $12.75 per paycheck, or $25.50 per month. Short-term disability would cover you for up to 6 months. At 6 months, if you were still disabled and had long-term disability insurance, long-term disability would begin. If a period of disability begins within 730 days of your effective date of coverage, that disability is subject to the pre-existing condition limitation provision. If the disabling condition is found to be pre-existing, benefits are not payable for that disability. This provision applies to all employees who enroll for coverage. A pre-existing condition means any accidental bodily injury, sickness, mental illness, pregnancy, or episode of substance abuse for which you received medical care during the 365-day period before your effective date of coverage, or the effective date of a change in coverage. Long-term disability still protects income on a monthly basis, but is based on the yearly amount you earn before taxes. Please make sure to review the important information on the first few pages of the long-term disability brochure included in this packet. This covers information like exclusion and waiting periods, eligibility, and maximum coverages. To illustrate how long-term disability works, if you earn $31,000 a year before taxes, the maximum amount of monthly income you could protect under the long-term disability plan would be $1,600. This would be the maximum amount of income from all sources. It's important to note this, as sometimes people that are on long-term disability receive other income from sources such as Social Security disability. For example, if you were to get $600 from Social Security disability, the Hartford, our insurance provider, would pay you only $1,000 per month to get you to the $1,600 monthly maximum. $1,600 of coverage per month would cost you $4.64 per paycheck, or $9.28 per month. Just as with short-term disability, you could purchase a lower amount of coverage for less of a cost. For example, coverage for only $1,000 of monthly income would cost $2.90 per paycheck, or $5.80 per month. You can choose to purchase only short-term disability insurance, only long-term disability, both, or neither. One important thing to remember about optional life insurance and short and long-term disability insurance is that if you purchase these insurances as a new employee within the first 35 days of your employment, you have guaranteed coverage. If you wish to add these insurances at a point in your employment later than the first 35 days, you may be able to do so, but you would need to provide evidence of insurability. This means that you will have to fill out a health screening questionnaire, and may have to see a doctor for a physical based on the results of that questionnaire, before the insurance company makes a decision on whether or not to cover you. If you add these insurances within the first 35 days of employment and within the guaranteed coverage amounts listed in the optional life insurance brochure, though, your coverage is guaranteed. It is important to note that while long-term and short-term disability are open at new higher benefits enrollment, these insurance may or may not be available to enroll in at open enrollment each year. Short-term disability is usually open for enrollment during the year with evidence of insurability. The state now offers vision insurance as well. Our health insurance plan covers an annual eye exam at no cost to the employee under our health insurance plan, and any diseases of or injuries to the eye would also be covered under health insurance. We also offer optional vision insurance to cover glasses or contacts. Please note that vision insurance is provided through Blue Cross/Blue Shield. If you elect for vision insurance, you will receive a Blue Cross/Blue Shield card for vision insurance only, even if you have health insurance through Health Partners or Preferred One. This will not change your health insurance provider and is only for your vision coverage. For an in-network provider, glasses lenses are covered once per calendar year 100% after a $10 copay. Frames from a select collection are covered once per calendar year at 100% with no copay outside of that collection. Frames are covered at 100% for up to $200, with a 20% discount on the remaining cost. The additional 20% discount is not available at Costco, Walmart, Sam's Club, or online retail providers. There are various levels of coverage for lens enhancements with varying copays. For in-network providers, select collection contact lenses are once per calendar year up to 8 boxes disposable and 4 boxes non-disposable at 100% of the costs with a $10 copay. Non-select collection contacts are covered once per calendar year for up to $150 of the costs, plus a 15% discount on the remaining cost. The additional 15% discount is not available at Costco, Walmart, Sam's Club, or online retail providers. For additional questions on vision coverage, please see the vision FAQs in the packet. You can also contact Davis Vision/Blue Cross Blue Shield directly through the contact information on the vision overview page in the packet. Vision insurance rates are $2.88 per paycheck for employee-only coverage, or $8.27 per paycheck for family coverage. Pre-tax benefits are also an option for you. These benefits allow you to have a portion of your income taken out without taxes for eligible medical, dental, dependent care, and public transit expenses. For example, an employee who wears contact lenses knows that they have a fixed cost of $200 per year for those contact lenses. It may make sense for that employee, knowing that they will have that fixed expense at the end of the calendar year, to elect to have $200 taken out in pre-tax benefits for that year, to save the tax money on that $200. We also have the option of having money set aside pre-tax through the medical/dental expense account for glasses or contact lens purchases. For this year, you can elect to have up to $2,750 set aside for the calendar year pre-tax for eligible medical and dental expenses. When you are electing your annual amount, please keep in mind the number of pay periods remaining in the year, as compared to your start date. For example, if you start in the summer or middle of the calendar year, and there are 26 pay periods in a non-leap year, then you will only have about 13 pay periods remaining in the calendar year. If you elect to have the full $2,750 taken out for the year, that will result in approximately $211 being taken out of each paycheck. Additionally, as there is only a $550 rollover amount for this year, any dollar amount above $550 remaining in your medical/dental expense account at the end of the year will be forfeited if you did not use it within that current calendar year. You can elect to have up to $5,000 taken out pre-tax for this calendar year for dependent expenses like childcare. Please note that there is no rollover for dependent care expenses. Any money you don't use within the calendar year is forfeited. You can also have money taken out pre-tax for public transit expenses, like if you take Metro Bus or the North Star train to work here at SCSU. Please note that while the benefits enrollment menu will give you the option of selecting a parking expense benefit as part of your pre-tax enrollments, you would not want to opt in for this as an employee of SCSU. The parking expense pre-tax option is only for state employees who use non-state-owned parking ramps, like in downtown St. Paul. If you want to use our SCSU parking lots and not pay tax for the parking permit, please see Public Safety and ask to purchase a parking permit through payroll deduction, which will let you purchase a permit tax-free. It's important that you either enroll in benefits during the first 35 days of your employment or benefit eligibility period, or that you enroll in health insurance only, and then complete a waiver form to waive your insurance. In order to be eligible to waive health insurance coverage, you must have other health insurance coverage. To waive health insurance, you will need to complete the waiver form and submit that form to the State Employee Group Insurance Program per the instructions on the waiver form. If you do nothing, the state will automatically enroll you in employee-only coverage on the 36th day of your employment. We have had employees who have had coverage through a spouse who've forgotten to enroll and waive health insurance, who have been automatically enrolled in employee-only coverage. They then could not get out of that coverage for the rest of the calendar year, and had double coverage, and were paying 2 sets of premiums for both coverages. We have also had employees who have spouses or children who needed coverage, and who have forgotten to enroll in health insurance for family coverage. On the 36th day of their employment, they were enrolled in employee-only coverage. They could then not change to family coverage for the entire rest of the year, and their families had to go without state health insurance. Again, it is very important to do something in the first 35 days of your employment, either enroll in benefits or enroll in health insurance, and then complete the waiver form. Otherwise, the state will automatically enroll you in employee-only insurance. To enroll in benefits, click on the Benefits Enrollment link in the Employee Self-Service Portal, as shown in the highlighted link on the page. This will bring you to a list of questions about what insurance and benefits options you want to enroll in. This list is relatively straightforward, but if you have any issues or questions as you go through it, you can contact a benefits specialist in Human Resources for assistance. The current year benefits handbook is included in the packet you received. It's important that you read through this benefits handbook. The handbook covers in detail what this presentation only went through as a brief overview. There are very important details on all of the aspects of state benefits covered in the benefits handbook, and it is very important that you read through it before you make your benefits selections. As a benefits eligible employee, you will be participating in one of the state's mandatory retirement plans. Your participation in these plans is required by state law. If you are a staff member, you will be participating in the Minnesota State Retirement System's General Pension Plan. You can find more information on the General Pension Plan on the Minnesota State Retirement System website. This website is listed on the last page of the Minnesota State System Mandatory and Voluntary Retirement, along with a brochure on the general pension on their website. You must be employed for 5 years prior to being vested, which means that you are able to draw a pension benefit upon retirement. If you are a faculty member, including MSUA, ASF, or IFO faculty, or an administrator, you will be going into either the Teachers Retirement Association (TRA) plan or Individual Retirement Account Plan (IRAP). The Mandatory and Voluntary Retirement Plans brochure will explain the difference between these two plans in greater detail, but the main difference between these two plans is that the IRAP plan is more like a traditional 401k plan in that it is a defined contribution plan, and the TRA plan is more like a traditional pension plan in that it is a defined benefit plan. You will also begin paying into the supplemental retirement account after you have been employed for 2 years. The default plan for this is IRAP. If you are a faculty or administrator employee, the Service Center will review any past retirement plan participation history from Minnesota you have, and will enroll you in the appropriate plan, based on their review and the state policies and procedures for retirement plans. Generally, if you have no prior state retirement service, you will go into the IRAP plan. Generally, if you have prior state service, you will go into the TRA plan. Once the service center determines the appropriate plan for you, you will receive a form notifying you that are enrolled in that plan, and that you have up to 1 year from your eligibility date to switch into the other plan. If you do wish to switch plans, contact HR for assistance in doing so. You can find the amount from each paycheck that you will contribute to retirement, and the amount of your pay that the state will match for your retirement contributions, in the brochure. For example, if you are covered by the Minnesota State Retirement System General Pension Plan, you will contribute 6% of each paycheck into the pension plan, and the state will match this with 6.25% of each paycheck amount. You cannot increase or decrease this, or the amount you contribute to any of the mandatory retirement plans. The amounts you contribute under each of these plans is set by state law, and can't be changed. However, if you want to save additional money for retirement, you can choose to participate in one or both of the voluntary plans that the state has available. These two plans are the Deferred Compensation Plan and the Tax Sheltered Annuity Plan. The basic difference between these plans is that if you choose the Deferred Compensation Plan, you can withdraw the funds from the plan anytime after you've left state employment, with no penalty. With the Tax Sheltered Annuity Plan, if you withdraw your funds anytime before you turn age 59 and a half, you have to pay a 10% tax penalty. Both plans offer the option of before tax or after tax contributions. With the before tax option, the money you deposit into the plan goes in without having tax money taken out. When you withdraw money from the plan, it is taxed as it comes out, at the tax rate that you are in when you withdraw it. This is often a lower tax amount after you have retired, due to earning less in retirement than when you were working. If you contribute after tax, you pay taxes on the money before it goes into your account. Then when you withdraw the money, you don't have to pay taxes on it, as you already paid taxes when you put it into your account. You can find additional information about the Tax Sheltered Annuity account by contacting TIAA, which administers this plan. You can learn additional information about the mandatory and voluntary retirement plans from the relevant plan administrators. The Minnesota State Retirement System administers the General Pension Plan and the Deferred Compensation Plan. TRA administers the Teachers Retirement Association Plan, and TIAA administers the IRAP Plan and the Tax Sheltered Annuity Plan. There is a video with additional information about the IRAP and TRA plans available. This is a clickable link in your PDF packet. This brochure will give you detailed information on the Deferred Compensation Plan. It's highly recommended that you read through the brochure, which will give you information on investment options, including target retirement date investment options, or the ability to choose an individualized investment portfolio. If you are in the MAPE, AFSCME, Commissioner's Plan, Managerial Plan, Middle Management Association Plan, or Minnesota Nurses Association Plan, then your contract includes a provision for a deferred compensation contribution match. This means that if you contribute up to a set amount, fixed by your contract, to the plan each year, after you have met your probationary period, the state will match your contribution into the plan. For example, if the match amount under your contract is $250, then if you contribute $100 into the deferred compensation account, the state will contribute $100 into your deferred comp account. If you contribute $250 into deferred comp in a year, then the state will match $250 into your deferred comp account. If you contribute $500 into the deferred comp plan in a year, then the state will contribute only $250 into your deferred comp account. This is a one-time per year match. You must request this match through the employee self-service portal. You will not receive the match if you do not request it. If you are covered by one of the relevant plans, ask your HR representative how much your contract specifies that your contribution will be matched by the state. If you plan on participating in the deferred compensation plan, the enrollment paperwork is located within your benefits packet. It's recommended that you sign up for deferred comp through the enrollment paperwork, as this paperwork is required to designate a beneficiary and choose investment options. You can enroll in deferred comp through the employee self-service portal, but the state retirement system will still send you this paperwork to complete the enrollment, so signing up through this paperwork will save you an additional step. You can use this paperwork to choose the amount, either a fixed dollar amount, minimum of $10, or a percentage of each paycheck to contribute. The last page of the benefits packet shows the menu option under the other payroll and savings plan menus of the employee self-service page that you would use to enroll in the tax-sheltered annuity or deferred comp plans through the employee self-service portal. Click on this option and then choose which plan to contribute to. You will then choose the amount, either a fixed dollar amount, minimum of $10, or a percentage of each paycheck to contribute, and whether you want to contribute before or after tax. This concludes the benefits overview presentation. Please be sure to read through the complete benefits handbook and review the benefits packet before you make your benefit enrollment decisions. Please let your HR representative know if you have any questions.